Andy, thank you very much for giving us some time out of your hectic NCRI schedule. All these abbreviations, NCRI, BACR, or APC or ACP, I don't know what they all are. BACR is your baby, and you're the president of the British Association of Cancer Research.
I'm the chairman of the executive committee.
So what does that mean?
Basically, the president is Bob Suhami, and he is the figurehead at the moment, and I'm for 3 years basically looking after the business of the BACR.
Which is what?
Which is the British Association for Cancer Research is devoted to support cancer research in terms of enabling members to suggest meetings, small meetings, where certain issues which may be particularly pertinent at that particular point could be discussed, and the BACR will help if somebody has a good idea to set these meetings up. It also is devoted to support young scientists if they have a good case to go to meetings, to give bursaries, or to go to other laboratories to learn certain techniques. So basically oiling the wheels of research with a preponderance on support for young people.
And it's basic research?
It's all sorts of cancer research, from basic to translational to clinical. We also give prizes to people who have done every year a particularly good piece of work in the translational area, and people who have done, or somebody who has done particularly good work in the area of general cancer research, of basic cancer research.
So who got the prizes this year? And
this year,
for what?
This year there was the AstraZeneca BACR Frank Rose Prize went to a presentation to a young scientist from the CRUK Cambridge Research Institute.
That was
Carol, Sir Jason Carroll, who has made has some very original data on, he's obviously less than 35 years old, data on how particular genes which are associated with the estrogen receptor gene, how they can be modulated, and he has some novel ideas, and he gave a very good presentation. And then we also have to decide on the best poster in a particular area, which is the Gordon Hamilton Fairley Prize for the best poster, and that decision will be taken today.
That's still a secret?
Yeah.
You can't tell us yet?
No, I can't tell you that.
Oh, that's terrible. Will you come back and tell us what?
I will, of course.
So how does this British Association link with the European Association of Cancer Research, or does it?
Oh, it does. The British Association of Cancer Research is one of a number of cancer research organizations in Europe, like the Italian equivalent or the German equivalent or the French equivalent, which are all in a way contributing to the EACR, to the European Association of Cancer Research. And actually the members of the BACR are by default also members of the EACR. And the EACR very often organizes meetings in conjunction with one of the national organizations, and the BACR is quite upfront in that. And they have, for example, a biannual or annual meeting on novel insights in cancer drug development, which occurs at the University of Nottingham every year, and that's run by the EACR, and the BACR has an input into that.
So you're going to sort of helicopter position looking at all of this, Andy. What are the hot topics for interesting mini symposia or little meetings out of the British research contingent for the next year or so? What do you think is catching your eye?
Well, there was recently a very successful meeting a few months ago on chromatin and cancer, which had which was made had a number of enough punters so that there was a little profit. A small meeting coming up, a one-day meeting in the spring in London, will be devoted to biomarkers in the development of new anti-cancer drugs. Obviously a topic which also has been, or biomarkers in general, is a topic which has been covered a lot at this meeting and is obviously very, very topical. And another meeting devoted, biannual, occurring every 2 years, is on preclinical models. What are our latest thoughts on preclinical models in testing for new anti-cancer drugs? Mm-hmm. So it is, the idea is that some members may suggest, oh, I think there has been a lack of discussion about a particular topic. and we should get together to do that. Now, I could imagine that with the proliferation of meetings, which is happening, you know, has been happening over the years, that the need may decrease. But at the moment, there are a lot of ideas of people who want to put on meetings.
Now, you have a little hobby called chemo prevention, right?
Yes.
So tell us why you're not having meetings on that. Is it sorted, or where is your work going in chemo prevention?
The work of collaborators and clinical collaborators and lab collaborators in Leicester, devoted to the development of new cancer chemopreventive agents, which come from, if you want, agents which are contained in the diet or naturally occurring agent. I think we are making, I would say that wouldn't I, good progress. We have done recently several clinical sort of first in human studies with agents which are derived from the diet. One of them, resveratrol, a constituent of red wine, and another one, anthocyanins, constituents, plural, it's constituents of berries, bilberries and other berries. And we are one of the few groups in the world which are devoted to set the scene to get some data in humans based on preclinical data, which then will help for anybody who may have the cash and may have the will to do proper intervention trials with this type of agent. And if you ask about meetings, there was a BACR meeting about 2 years ago devoted on chemo prevention or cancer prevention and the diet at the University of Nottingham, which was reasonably well attended.
You were the first to put curcumin up, the active ingredient in curry. Mm-hmm. And you know, I remember you having difficulty getting people to listen to you. And now I think you must be quite happy that you were right, and the studies are going very well all over the world, as far as I can see.
Yes.
Where are we with curcumin?
Curcumin, it is interesting that I think now, in terms of the hierarchy of agents which are lined up to be fed into clinical trials, for example, at the level of adenoma recurrence prevention trials, curcumin is creeping up. I think I heard somebody say a few months back it's probably the next one after, it's number 3 or 4 in the hierarchy. We have and other people have done studies where we wanted to see what actually can we measure any curcumin pharmacokinetics, some pharmacodynamics in a few individuals, healthy individuals and patients. And with my clinical colleague, Professor Will Stewart, we have been successful in generating interest for a clinical trial where curcumin should be progressed into an adenoma recurrence prevention trial. However, we still don't know. There is the feeling was of CTAC, the body which makes the decision about whether clinical trials are being instituted or not, about whether there is enough data to suggest that the levels of curcumin at the target site is high enough. So actually, as we speak, we have the first patients with polyps or colorectal malignancies take curcumin, and we take the target tissue and measure whether the levels are in the range which would suggest to us that they have pharmacologic activity, that it has pharmacologic activity.
Good luck with that, Andy.
Thank you very much.
I hope you turn out to be right.
Thank you.
I'm sure you will.